the gold standard intervention agreed upon by basically every medical body worldwide is something called cognitive behavioral therapy for insomnia, which is a series of largely behavioral but also some cognitive strategies for correcting your sleep behaviors and getting them healthy again. And there are two primary components to cognitive behavioral therapy for insomnia. One of them is called stimulus control therapy, and the other is called sleep efficiency therapy, or sometimes sleep restriction therapy.
And they are making sure that people know just to not try to sleep, actually just get into bed when you're sleepy and tired, not just tired and not because the clock says you should. Making sure that if you're suffering with only less than 5 hours sleep, then don't get into bed for 8 hours. Make sure that you match the time in bed with the amount of sleep that you're currently getting. Making sure that you have a non-stimulated environment and that you're only in bed for sleeping.
The nice thing about CBT for insomnia is that for many cases, many individuals, it only takes 6 to 8 weeks to complete the entire treatment. And some people can actually do it with only, say, 4 visits to the psychologist, and then they have the knowledge and they have the skills to continue the treatment on their own at home. So it is a relatively short-term treatment option. It's fundamentally about behavior change. We develop and maintain a chronic insomnia because our sleep-wake behaviors are not as healthy as we need them to be. Even if we're doing things that we think should be helping our sleep, they often aren't. And so treating insomnia is all about changing behavior. Now, anybody who's tried to diet or exercise or any of that kind of stuff knows that changing behavior is really hard. And treating your insomnia is no different. It's a very logical process, but it requires difficult behavior change. And what that means is people have to be prepared to follow the treatment recommendations even when they're not particularly comfortable tonight, because they have to realize that in the long term it's going to make them sleep better. So it's a little bit of short-term pain for a lot of long-term gain.
The success rates with CBT is as effective as a medication, okay, but more sustained.
This is something that's been done for decades now. It's very refined treatment, and 75% is much higher than any other therapy. Most therapies do not hit that high. So when we look at our suite of options, we've got CBTI, sleep hygiene and medication, and really all of the evidence points out that CBTI is the most effective option.